I say hello to all. I am Dr. Manchanda, a physician and intensivist at Asian Hospital, Faridabad. So what is sepsis? Sepsis is actually a life-threatening organ dysfunction which occurs whenever there is an infection in the body. And this infection could be due to bacteria, viruses or fungi. So when there is organ dysfunction, the body starts having an immune response which starts attacking the body. And this triggers an inflammatory cascade which causes trouble to the body and the organs start failing. The organs usually which start failing are either the lungs or the kidneys, or there is a low blood pressure, or the platelets and the body response is such that the platelets and the blood becomes thin and they become secondary complication of sepsis. So the earliest sign and symptom of sepsis is usually starting with a fever, and then there can be altered mental status, there can be low blood pressure, there can be heart rate which is increased, there can be respiratory rate which is increased. And depending upon the organ involved of sepsis, like if there is a pneumonia, the patient may have some chest symptoms like cough and sputum and chest pain. And if the symptoms are related to the kidney, then there will be burning, micturition and decreased urine output. So depending upon the specific organs, there may be some specific symptoms. So the crux is to diagnose sepsis early, because each hour of wasting of diagnosis has a life-threatening problem for the patient. So as soon as we diagnose sepsis, we have to start him on IV fluids and antibiotics depending upon our local microbiology flora and the organ which is involved. So the earlier onset of treatment saves many lives. We of course then need to do certain blood tests to confirm the sepsis. To the extent of sepsis, we can do a Q-SOFA score to see how much the patient is having a problem with the sepsis. So again, I will highlight that we have to diagnose early and treat as early as possible. Thank you.